Good morning. And today we'll be discussing on counseling. When talking about counseling, you must remember what we call gather. It is what we use to counsel. Where G means you greet the patient. A means you ask her what she knows about the diagnosis of her child, because we are dealing with pediatrics here. T means you tell her. Then H means you help her to understand. Then E means you explain everything to her. Then R, you recall all the things you said and ask her if she understand. And if you have any question to her, she can ask and all of that. So let's put that into a very organized way by using sickle cell anemia patients. Let's say a woman comes to the hospital and her child has sickle cell anemia and you are asked to counsel. This was the question that came out in our own exam. Yes, this is the question that came out in our own pediatric main exam. So any other counseling can come, or they may even repeat the subsequent years. So let's quickly go with this. So what should you do? So let's go. First thing, you greet. Let me just do it as if it's an exam mood. Good morning, ma. Good morning, sir. I'm Biabo Jaswi. I'm a candidate of this exam. I've asked an examiner to counsel you. Can I go on, ma? Thank you very much, ma. Are you comfortable with my language? Are you comfortable with the environment? All right, thank you very much, ma. Please, do you want any other person to be here with us? Oh, thank you very much, ma. Please, who is this child to you? Okay, your son. How old is he? Okay, where do you people stay? Thank you very much, ma. Please, what do you know about the diagnosis of your child? So that's ask. Oh, your child has sickle cell anemia. Where did you get that information from? Where did you get the information from? Oh, thank you very much, ma. So from history taking and physical examination, it is most likely that your child has what we refer to as sickle cell anemia. Sickle cell anemia is actually a disease condition, a condition that a child actually inherits from the parents. When a man who is AS gets married to a woman who is AS, can give birth to a child who is SS, and we say that child actually has sickle cell anemia. Simply put, what caused this sickle cell anemia is simply a little change in the genetic makeup. In the genetic makeup of your child, there's what we refer to as chromosome 6. In that chromosome 6, there's a place where there's supposed to be what we call glutamic acid, but now there's now valine. That symbol change where you're supposed to have glutamic acid and you now have valine. That is the whole thing that causes this whole sickle cell anemia. So that single change is the cause. Now, for somebody that have sickle cell anemia, they may become sick at times, and there are some things that can make them to become sick. So what are those things that can make them to become sick? Number one, we have what we refer to as dehydration, not taking enough water. Child is not drinking water as she's supposed to. Sickle cell patients are supposed to be drinking a lot of water. So when that child is not taking water, the child may come up with symptoms. Other things include extreme of temperatures, excessive cold or excessive hotness. It can actually result in it. When they have infection like malaria, it can actually result in causing them to have their crisis a lot. You get emotional stress from work, stress from school. All of this can make them to come up with this their normal crisis. Now let's go to the symptoms. What are the things that you see to know that this your child actually has sickle cell anemia? Some things that your child will come up with to know that your child has sickle cell anemia include things like bone pain. They complain that the bone is paining him or her. Then you also see that the back of the hand and the legs will become swollen. They will become sick more frequent than other children, and even their appearance may change. This may tell you that your child actually has sickle cell anemia. Now, what are the things we do to be very sure that this is sickle cell anemia? There are some tests we are going to carry out for you. Some things like sickle cell hemoglobin. There are some tests we are going to carry out on you. Some tests like hemoglobin electrophoresis, sickle cell sickling tests, even genotype. With this, we can be certain that your child actually has sickle cell anemia. Now, it is very important you treat this condition, because if not, some complications may result. Some things that may result if it's not well treated or not well taken care of include the child may come up with what we refer to as stroke. The child may come up with what we refer to as seizure. The child may have a lot of infections of the chest. It may even affect the stomach and the intestine so that you will not be able to digest food anymore. Some child may not even be able to give birth because they become infertile. These are some of the complications that may result from sickle cell anemia. Therefore, it needs to be managed. We need to keep on treating it. There are some drugs we are going to give for treatment. First of all, you need to know that those things that triggers this patient that has sickle cell anemia must be avoided. For example, dehydration. So you have to be giving your child excess water. It helps a lot. Yes, it will prevent the crisis from coming up every time. You get now. Apart from excess water, other things like extreme of temperature, excessive cold, no. Excessive heat, no. Excessive stress, no. Your child don't need these things. Do you get now? Now, what are other things you can do? Other drugs that can be of help. There are some drugs which we refer to as hydroxyurea. Other drugs, folic acid, nicosan, vitamin B, vitamin C. These are different type of drugs that are given to a child that has sickle cell anemia, and they actually help this child in doing better. Now, you don't need to start taking drugs, and when you see that your child is doing better, you stop. You need to keep on coming to the clinic. We are going to schedule a visit. You come, schedule visit. You have visit that you'll be coming every time. Just be coming so that you'll be checking and assessing your child for continuous follow-up. If you keep on following up properly, giving your child these drugs, the prognosis is far better than somebody who do not follow up. Do you get now? Do you understand what I said so far, ma? Okay. Do you have any question? Okay, can you repeat some things I've said? Thank you very much, ma. I really appreciate your time, and I really thank you for giving me a listening ear. Thank you very much, sir. Thank you, ma.